video will demonstrate inserting a peripheral intravenous IV catheter. The objective is to safely insert a peripheral IV catheter for use to administer IV fluid and/or medication. First, check the medical order to insert a peripheral IV. Gather necessary supplies. Identify the patient, provide privacy, and explain the procedure. Ask about allergies to medications, tape or skin antiseptics, and possible no-stick areas. Verify information in the patient's medical chart. Position the patient and perform hand hygiene. Assess the patient. Apply a tourniquet. Palpate extremity for an appropriate vein. Identify a vein for use to insert an IV. Remove the tourniquet and place a protective pad under the area. Prepare equipment. Open the short extension tubing package and connect a syringe of normal saline to it. Fill or prime the extension tubing. Loosen the clear end cap on the extension set and place it back inside the tubing packaging, placing it in close reach. Tear off strips of tape and place in close reach on a clean surface or an edge of the tubing package. Put on clean gloves and palpate the vein. Reapply a tourniquet several inches above the vein's venipuncture site. Clean the venipuncture site with antiseptic solution using a gentle back and forth motion. Do not touch the prepared site after cleaning. Open the IV catheter. Using your non-dominant hand, pull the skin taut from above or below the venipuncture site. Align the IV on top of the vein and enter the skin with the IV needle, holding the catheter by the hub in your dominant hand, bevel side up at a 10 to 15 degree angle. Watch the chamber of the IV insertion needle as you insert it to assess for blood return. Advance the IV needle and catheter until blood return is seen in the chamber. When blood return is identified, stop advancing the needle and advance the IV catheter only. Advance the catheter until the hub is at the venipuncture site. Release the tourniquet. Using your dominant hand, quickly remove the needle device from the catheter. Engage the safety needle protection device. Quickly remove the protective cap from the extension tubing and connect the extension tubing to the IV catheter.
Oh. I'm sorry.
It's okay.
Can we edit?
Can edit. Quickly remove the protective cap from the extension tubing and connect the extension tubing to the IV catheter. Screw the tubing to the IV catheter. Stabilize the catheter with tape. Gently flush the IV catheter with the saline, observing for signs of infiltration or leaking. Place a transparent dressing or catheter securing stabilization device over the inserted IV catheter. Remove the syringe and loop the tubing near the site of entry, securing with tape. Label the IV dressing with the date, time, type, and size of catheter, and know that you will document this in the patient's chart. Dispose of the IV needle in the sharps container. Dispose of equipment. Remove gloves and perform hand hygiene. Routinely assess the IV.